Can you see this place here? Population stabilization refers to the state where the size of the population remains relatively constant over time, right? With the birth rate equal to death rate. So how we will symbolize? We know very well mortality, natality. Natality means birth rate, mortality, death rate. Department of neonatology. Okay, if you're going to any one of the gynecology hospital, which is having a well-established multi-infrastructure, there you can see the separate unit called the separate unit. We can see the Department of Natality, right? So in this natality department, all the newborn babies are monitored very seriously if they are getting any genetic disorders or not, or what type of nutritional disorders. All the level of issues are screened more appropriately, right? So population stabilization is essential to ensure a sustainable and balanced society, right? The death rate suddenly drops, long lifespan, okay, modern healthcare facility, disease avoidance, agriculture related technology, improved transport option, defense against environmental element, a risk in the population of the woman. All these things are very, very important to maintain a stable population, right? So agriculture related technological advance. For example, I need to serve the poor with a well balanced diet at a cheap price. For that, I am using cluster of genetic techniques. Okay, here if you're talking about the long lifespan and greater longevity, that is because we are giving the vaccination, we are giving the proper dietary plan, pamphlets, okay, messages, etc. Not only by audio, video, and even by social media. Um, Now, defense against environmental element. Environmental element. Okay, for example, if the humidity level changes, we are having the maximum probability of getting nausea. We are having running nose. We are having itching sensation. So, like this, many issues are arising. Okay, when we are experiencing the environmental factors. For example, I told one example: humidity change in the atmosphere. Because of that, few are getting the cough cold. In addition to this, if some are having psoriasis issues, is okay, that will spread very fast to us if we are using their used items. Their used items. Like this, what we should be very, very careful in all the level by maintaining our hygienic body, by sterilizing our body with the proper antiseptic creams every time. For example, I am taking the diet. Before that, I need to have a sterilization. Okay, for example, here I'm climbing the staircase. I kept the all the fingers, over the staircase handles. Okay, here the moment when I'm reaching the office, immediately what I need to sterilize my hand. So everything should be taken care more properly in all the aspect. Why? Because microorganism spreads very faster by touching. Also, that means it is a communicable disease. It spreads very fast, right? Now, if you're entering into the population stabilization, one important point is infant mortality rate and maternal mortality rate. So here, IMR is a key indicator of the population health, representing the number of death of the infant and 1 year of the age, right? Um, and reduced IMR is an essential component of the population stabilization. These are all the messages we are understanding, right? So now, if you're talking about the MMR is maternal mortality rate, okay? So death per 1 lakh live birth due to the complication under pregnancy. So why? What is the reason for MMR and what is the reason for IMR? If you're talking for IMR, okay, one probability is, okay, here the poor hospital facility. And second thing is the concerned mother not taken the proper diet, okay, that we can categorize under undernutrition, and might be the mother taken wrong diet, categorized under malnutrition. For example, the pregnant woman should not take papaya, okay, at any cost. Okay, the pregnant woman should not move around the industrial area. Why? Because the carbon monoxide spreads into their bloodstream very faster than the normal human being. Why? Because they are having maximum hemoglobin. The pregnant woman is having maximum hemoglobin in the blood than the normal human. So the maximum probability of carbon monoxide entry into the body. Like this, many probabilities, many examples we can give for the infant mortality rate. Why? Because, okay, now I'm explaining this sentence. So in the CBSE board exam, can you give few examples for the infant mortality rate? Can you give few examples for the maternal mortality rate? Okay, and explain the reason for the same in detail. If they're asking the case of 3 mark and 5 mark, we should be in a position to narrate the explanation more properly, right? Now we are entering into the next major concept. Is how can the population be controlled? One is rise in the marriage age, and second thing is vasectomy, tubectomy for the birth control is mandatory for reducing the population in the developing countries. And the second thing is in developed countries as well as developing countries, the family size and family planning techniques information should be given with a proper note. Okay, when to have a copulation. When to have a copulation means in the sense technically being a doctor, how we need to inform the particular couple having a sex in the ovulation time period will give the birth, but not before ovulation, not after ovulation. So that means if the couple is having the copulation or intercourse during the ovulation time, then there is a maximum chance of conceivement. Okay, that information we need to narrate for the illiterates and also for the non-medical couples, so that what they'll have a proper plan accordingly, right? Now, we know very well in the case of offering incentives to the family who uses medical planning technique. Basically, we know very well in the village, many people who are living below the poverty line are residing there. So for those set of poor category, we need to give the proper information. Okay, this is the way you need to correct it. RCSH denotes, okay, here you know very well, relative child health program. So in this reproductive child health program is a relative health program for the each and every married couple, which explains about when to have the copulation, when not to have the copulation, and how to keep the hygienic environment, and how to avoid the drugs intake. For example, all the antibiotics, whatever it is taken by the normal human for the various health complication, should not be taken by the pregnant woman just randomly without any type of doctor advice. Okay, for example, I'm taking the painkiller now. Okay, being a particular woman, if she's pregnant, okay, then she should not take the particular sleeping pills or any type of antibiotics with any type of doctor prescription. Okay, if they are taking the antibiotic, it causes serious consequences in the developing embryo, right? So now, if we're talking about the population control, will be carried out with a varieties of contraceptive devices and also by means of surgical procedures that we'll be discussing in detail one by one. Before that, we'll be going to the natural and traditional method, okay, how it is used to control the growing population size and birth control. Coitus interruptus. As a doctor, we used to say when the concerned couple is involved in a copulation, the concerned male knows very well in this time the semen is getting released from his body. At the time, removing the external genitalia. Removing the external genitalia means the copulatory organ. I am saying indirectly that is penis. If you are removing the particular penis segment from the female body, okay, then we can avoid the entry of the semen into the particular female body. Like this, we need to convey the message, being a doctor, to the patient, and also to the normal human who are having a lot of literature issues. So that will be rectified with this type of narration by giving pamphlets, audio, video, sound narration. Everything will make them to improvise their conditions, right? So both the partners may experience physical and mental issues. Some sperms may be deposited in the vagina even before the sexual climax. So all these sentences are exactly taken or extracted from the CBSE NCERT textbook. Okay. So this is the essence, this is the crux, okay, for your better understanding and for better narration in the board exam, right? So now, as I already told to you, the sperm cells sticking to the vagina have the maximum probability of getting entry into the fallopian tube. Once this is completed, there is a maximum chance of conception. So there is a reason why we are saying n number of time to the concerned couple. Once the copulation is completed, cleaning the external genitalia or copulatory organ is very, very important if they don't want to have the fetus development, right? So now we are coming for the next segment, periodical abstinence. So according to the conventional wisdom, okay, it is safe to have a sex 1 week before or 1 week after the menstruation phase. What do you mean about this? So see, the periodical abstinence indirectly explains that if you are having the copulation before ovulation or after ovulation, not during ovulation. Either the concerned couple, okay, can have intercourse before ovulation or after ovulation. There is no chance for conceivement. There is no chance for gestation initiation. There is no chance for fetus development. There is no chance for embryo origination. We can say in many grounds, right? So they will play the games with many words and many sentences. Lactation amenorrhea. So here the mother does not have menstruation and ovulation during the period of strong lactation. Strong lactation means milk ejection, milk giving period or lactation period. In that time period, the particular woman should not have um, should not have the improper drug intake. In the sense, they should not have any type of beverage intake. Beverage intake means in the sense I already categorize bad beverage and good beverage. Bad beverage intake is wrong, and bad medication is wrong. So why? Because in this lactation period, the concerned fetus is getting only the milk as a supplement, as a only one dietary supplement for the particular growing child, so that what that should not be disturbed. Okay, and in that time period, if the couple is having the intercourse, there is no issue at all. There is no chance for new baby development. This is level 1 explanation. Level 2 explanation, why there is no chance for the baby development during the very good lactation period. Whenever you're asking the question, they need exact information, technical information, not like a social information. Just randomly, we should not narrate anything. Being a biology student, okay, we need to write the degenerated endometrium after the parturition will take a lot of time to become normal by developing n number of tissues, blood vessels, and capillaries. Like this, when we are narrating, there is a technical information. There is a technical information, right? So randomly writing some social information, okay, will not give the proper mark. So what answer should be given? Why during lactation amenorrhea period there is no chance of conceivement, even though the concerned couple is normal? Okay, okay, here the endometrium takes a lot of time to get regenerated. Okay, why? Because it drastically loses tissues, blood vessels, and capillaries when the concerned mother given the baby. Like this, we need to narrate in detail, right? Now we are coming for the next segment, artificial techniques. Mechanical barrier. What do you mean about mechanical barrier? Okay, we know very well not only the condoms, many varieties of contraceptive devices are there. Okay, femidome, okay, female condom, like this we are saying. Okay, so these condoms basically, male condoms and female condoms avoids the sexually transmitted disease causing microorganism entry. I'm a microorganism. I cause a sexually transmitted disease. I can't enter into any one of the sex of the couple because of the very good protection condom, whatever they're having. Means the sense the condoms means nowadays the condoms are coming, okay, well developed condoms means branded condoms, and just random condoms which is there in the market, that should be ignored. Okay, I'm saying about the good condoms of the good companies should be used. Okay, so then there is no chance for the sexually transmitted disease-causing microorganism entry into the particular couple. Diaphragm, the word is having different meanings. See, listen, I already told to you, one word in biology is having multiple information. Diaphragm for both plant and animal we can use? No. Only for animal we can use. For all the sex we can use? Yes, of course. Okay, diaphragm separates the chest position and the stomach position. We know very well. Diaphragm, the word we are using in microscope also. Diaphragm, the word we are using in the case of eye lens also. So multiple information for the same word for the diaphragm, but here the diaphragm indicates contraceptive device, right? So the mechanical barrier composed of rubber are inserted into the female vagina to prevent the sperm entry into the uterus. Okay, so this rubber made a diaphragm, okay, is not allowing the sperm entry to happen, right? So now we are coming for the next segment. So be very careful. Okay, some students are writing diaphragm is existing between the stomach and the chest position. Of course, it is correct if it is human anatomy. Okay, but we are not discussing human anatomy here. We are discussing contraceptive devices. Here, the diaphragm meaning is totally different. Okay, now we are coming for intrauterine devices. Means what exactly? They are placed in the uterus through vagina by medical professionals. But because if it is kept in a improper way or not inserted properly, then there is a chance for concealment. Okay, why we need to introduce intrauterine device? To stop the population explosion by stopping the concealment of the particular couple. Uh, the other device, intrauterine device. What is IUD? Intrauterine device. Everything is not made up of copper. Few are made up of copper. That copper inactivates the sperm mobility. Okay, so that what the sperm will not reach the egg. If you're talking about the progesterone, basically released by the IUD, intrauterine device, there is another type of device. Okay, here that makes the cervix hostile to the sperm and the uterus unsusceptible for the implantation. Right. So here we need to understand, we already told n number of time, for the pregnancy to happen, the progesterone is playing a crucial role, being a pregnant hormone. Okay, we used to call progesterone as a pregnant hormone. Why? Because it's playing a multiple role in maintaining the pregnancy. If that to happen, we need to have a proper progesterone. Okay, the progesterone, if you are giving maximum than the required quantity, then what will happen is the uterus will go for improper intake of zygote. Improper intake of zygote. Why? Because the uterus endometrium development and the uterus movement, everything made randomly because of the progesterone injection. So that we are doing it as one of the birth control measure. Phagocytosis means the sperms are completely engulfed by the microorganism. So the sperm phagocytosis is increased by intrauterine device. So copper ion reduces sperm motility. Copper ion increases or reduces the sperm motility and ability to fertilize. That we already told for you. See, whenever you're talking about copper, okay, here I'm a CBSE student. I need to get full marks in biology. Okay, here you know very well in most of the states of India, they are considering CBSE score as one of the main score for getting the engineering rank. For example, Kerala Engineering Entrance Exam Board, they are calculating CBSE score also for getting entry into the best engineering rank. Okay, so that what you'll be placed in a very good engineering college. So the CBSE mark matters, but not in JE. In JE means they're not calculating. JE advanced they're not calculating, right? So here we should be very careful. If we are getting less score, our ranking system will be changed, right? So we know very well for that what you are saying, sir, finally. So the thing is, when you are talking about copper, inactivate sperm, which ion activates sperm? Like this, we need to think in double dimension. So you are saying copper is inactivating the sperm, then which ion is activating the sperm? Calcium ion activates the sperm. Calcium ion is coming from where? Who given to the sperm? Seminal vesicle has given. Where is the seminal vesicle? In the male. What is the seminal vesicle? Secondary duct, secondary gland. it is playing a crucial role, amazing role in giving the very good quality amount of calcium ion, right? So thereby the sperm motility is kept properly, right? So now we are coming for chemical method. In this chemical method, uh, what are the way to stop the consumment? One is spermicidal. Cidal meaning denotes the sperm killing efficiency. So spermicidal creams are available in the pharmacy. Before going for the copulation, they can apply over the penis or external genitalia or copulatory organ, so that the sperms will be killed. So even though it is entering into the female body, it won't causes any type of fertilization process, right? This is the other way of easy method of stopping the pregnancy, right? So we know very well some jellies and pastes are also available having the lactic acid and citric acid and potassium permanganate. Okay, all these things are the spermicidal creams. Sir, in which way you are saying okay, here the lactic acid and citric acid or organic acids, it changes the semen acidity. The semen acidity is deviated, or we can say simply the semen pH is deviated. Then what will happen is the concerned sperm will go for death because of the drastic pH change in the urinogenital tract. Like this, we should not use as like in the male. We can use only genital tract, the word. Okay, genital tract will be kept such a way there is no chance for the sperm entry into the fallopian tube. Why? Because the sperms are killed by this acidic components like lactic acid, citric acid. It's not strong acidic like HCl, HNO3. You know what is HCl? Hydrochloric acid. You know HNO3, nitric acid. So those acid capacity is not absorbed in this lactic acid and citric acid, right? Now we are coming for physiological oral device. For female, the hormone supplements are given in the tablet. I already told chemical methods. Acidity giving molecule creates issue for the sperm, right? So that the concerned couple will be not getting the proper consumment. The pills with the hormones, the pills having hormones are given more correctly. Pills having hormones are given more correctly. The hormones deviates the implantation. Pills are taken every day for 21 days, beginning on the first day, 5 days of the beginning of the first 5 days of the menstruation cycle. Okay. The pills are taken for every day for 21 days. Okay. So which pill exactly? Hormonal pill. What is that hormonal pill? Okay, here the Indian government giving a branded tablet that is called Shahali drug. Okay, and that Shahali drug is having progesterone and estrogen in equal concentration. That will be deviating the menstruation cycle so that there is no chance for the proper egg release, right? So now, if you're talking about the gap of 7 days, okay, here gap of 7 days in the sense it should be repeated for every 7 days. Then there is no chance for consumption. So why? Because if you're giving the medicine continuously, also there is a negative impact. There is side effect. Okay, why? Because the drug addiction or continuous usage of the drug addiction or continuous usage of the drug, after some time, even though we are not taking the drug to have a effective copulation, to have a effective consummation, at the time, what will happen? The entire normal cycle will be collapsed. Okay, medicine you can take for some time, not every time, as per the doctor advice. And second thing is we should give gap in between for every cycle. No, every day I'll take. Okay, even the doctor is giving the advice, every day I'll take. Okay, doctor told to give the gap, but I will ignore that. Means your health will be ignored. Okay, be very careful with this. And then the second thing is the quality of the cervical mucus. I already told cervical canal or birth canal is having the mucus secretion, right? That we are deviating to avoid the pregnancy. Okay, and then we are blocking the implantation. Blocking the implantation in the sense we are blocking the zygote attachment to the uterus. Now, if you're talking about the pills have less adverse effect and quite effective. Okay, that means to design less side effects. You know very well in our UP, Lucknow is having a beautiful, our central government institute, Central Drug Research Institute. That institute, it is offering non-steroidal medication as well, which will not create much complications or side effects. Okay, only micro side effects, which can be reversed very easily, right? So the disadvantages, nausea will be there, running nose will be there, bleeding will be there, abdominal pain will be there. Okay, and there is a chance for getting breast tumor, right? So taking medication is accepted, not every time, not every day. If you're doing this, what will happen is you will be having the maximum probability of deviation in the health. Implants and injectables. Female utilizes progesterone. Female utilizes progesterone um, or subcutaneous injection, either alone or in combination with estrogen. We know very well the progesterone and estrogen combination definitely deviates menstruation cycle. Deviates menstruation cycle, hidden sentence for that sentence, ovulation is interrupted. Hidden sentence of the ovulation, egg release is interrupted. Hidden sentence of the egg release interruption, fertilization is interrupted. So we need to bring all the points, hidden points beside this point, then only we can get the maximum score. Or else, if you're writing just like this, without any reason, they will reduce a mark, right? Now we are coming for the next phase explanation in terms of birth control is the surgical method. In the lower grade, we already had studied in the 10th grade, 9th grade like this of different curriculum. Here, the middle year program students of IB level, they are knowing this information in the 9th and 8th itself. Whereas the CBSE students will be knowing there is a grade 10. We know very well the male sterilization process. Uh, you know very well vasectomy, the word I am saying for the breakdown of vas difference. Okay, here in the last class, we discussed about vas difference. It's a duct coming from testes carrying the sperm cells that we already discussed. If the vas difference is broken and then it is tied appropriately, that is a permanent sterilization process or permanent contraceptive device application process. Okay, in this, the sperm will not reach the fallopian tube at any instant, even though the copulation is happening. Now, ovariectomy in this place, see by practice, okay, just like this, we are talking means we are having a number of practice. That is the reason why what we can talk very casually with very lot of easiness. But in this case, if you're practicing, you'll talk more than me. Okay, so the vaginal or abdominal incision is used during tubectomy to cut or tie up the fallopian tubes. The fallopian tubes we are tying. Okay, so there is nothing but what okay, ovariectomy. Okay, also called as tubectomy. Ovariectomy or tubectomy, both are same, indicating the sterilization done by surgically in the female body, right? In the male body, vasectomy, we already told you, right? So the tubular ligation involves a restriction, the fallopian tube with the laparoscopic, okay, laparoscopic. Here, so laparoscope surgery involves the less painful process, okay, than the big surgical process. Okay, laparoscopy surgery now it is very easy. So only we are giving local anesthesia and then we'll be giving the laparoscopy treatment so that the concerned couple will not get the chance for copulation, right? They will not get the chance for effective copulation product. There is nothing but zygote formation. So any one of you or having any doubt, please let me know. I'm there with you to help you. Here, any one of you having any doubt in this place? So I think so. No one is having the doubt. So I'm entering into the next important concept. Uh, Medical termination of pregnancy. Before discussing about those things, We'll discuss some few worked examples of this particular chapter, of this particular main unit, right? So the question is demographic transition theory and relevance is understanding the population trend provides example of the country that have experienced different stage of demographic transition. So demographic transition theory, how the population dynamic changes over time as a society industrializes and develops. It is divided into 4 stages: population trend, birth rate, death rate, etc. Okay. So here our demographic transition theory means the geographical isolation depending upon the different community flexibility and convenience habitat will make the very good quality treatment. So one more time I'll repeat, need not to worry, calmly you listen. This demographic transition and the relevant in understanding the population trend is very important, very important, right? So now if we're talking about the high stationary, yearly expansion, late expansion like this, low stationaries like this, we are giving all this information, declining. So in all these 5 stages, this is one of the classic worked examples we need to narrate for this particular question, right? So high stationary. So birth rate and death rate are high. Okay, there is the hidden meaning of high stationary. Yearly expanding, decrease in death rate due to the increase in healthcare, late expansion, birth rate start to decline. Okay, birth rate start to decline. So if for each and every sentence, hidden sentences are there. Like this, I already told to you. Like this diagram also there. See, expanding. Okay, like this they are saying means we are converting all the population into bar diagram, and we are understanding. So the population size is increasing towards this. The population size is decreasing towards this. Depending upon the various parameters, the area inside the curve directly proportional to the population size. The area inside each and every box directly proportional to population size. That is a message we need to understand, right? So now, if we're talking about low stationary, birth rate and death rate both are slow. Where, sir, actually this low stationary, can you give an example? Atlantic area. Okay, in this Eskimos are living not in huge population, less population. Okay, and Japan is also another example. Hypothetical decline. Okay, birth rate falls below the death rate. Birth rate falls below the death rate, right? So death rate is maximum in the case of declining stage. So here we studied about ice age. There the dinosaurs are killed in many number because of the change in the adverse climatic condition. That very strong chillness killed many dinosaurs. There was no predator for the dinosaurs. Okay, the reason is in the particular era, that particular time duration, the particular geological environment suited only the dinosaurs to grow, but not all other species to grow. But because the ice age entry, the chillness killed the dinosaurs. Like this, for example, if there is a great epidemic, you know very well, now we experienced corona, many people of many different countries died, many number. That is a great example for the hypothetical decline phase. They will ask the example. Can you give the example for this? Can you give the example for this? Can you give the reason for the same? Can you say the treatment for avoiding this? Like this, they will ask a twisted question. Those twisted questions we are calling as high order thinking skill question that should be systemized with the proper subheadings, and we need to give a proper point with the proper underlining of the keywords. Then the paper evaluator will feel comfortable in giving the very good marks, right? Now, if you're talking about the next important segment, before going to this, we'll go to the few pools. So in this poll, so we are discussing about which particular subtopic. Any one of you can say this information for this? Which particular subtopic we are discussing? We are discussing population stabilization. Yes. So in this population stabilization, before entering into the poll, we'll discuss a few questions of NCRT variety and then past paper variety. This question is taken in 2023. Name and explain the surgical contraceptive method that can be adapted by the male partner of a couple. Means obviously we'll be saying vasectomy. Vasectomy. I already told you there is vas difference dissection. Okay, if you are doing laparoscopic vasectomy, it is it is very easy to operate and also very less painful. So within a day, the concerned male can go for the work, right? So I think so. We given this many number of narrations for you, and now we are entering into the board question we discussed. One board question of last year, and next board question of 2023. Again, back we are discussing. Can you see this? All these points, all these labelings, we need to give it properly, right? So we know very well the Q is a point Q is a exactly denotes what exactly point Q and point R. So the point Q is exactly the vas difference, right? So now we are entering into the next question. So the labeling wise, they will ask a question. Match the following will come as a question. Fill in the blanks will come as a question. Diagram will come as a question. Board paper or the previous year will come as a question. And then NCRT examiner will come as a question. Okay, so we should be in a position to balance everything. That is what we given these number of varieties for your better attention. What is the primary goal of a population standardization, stabilization? Okay, if you're talking about to increase birth rate, to achieve a constant population size, to decrease the death rate, so here by balancing the birth and death rate, right? So by balancing the proper birth and death rate. So this is the message we are saying for you, right? So we discussed these number of questions. Okay, now we are entering into the worked examples. We already narrated, so we are going for tips for exam. So in this tips for exam, calmly listen to us. Okay, here statistics and data related to population growth, birth rate. So what type of statistics? For example, in this pandemic area, this type of population control is advisable. In this particular geological area, for example, in desert, these type of population control can be carried out. In this particular type of hill station, this type of population control can be carried out. Okay, like this, what? Depending upon the geographic area, depending upon the sex, depending upon the other associated medical complications. For example, the one of the member of the couple is having psoriasis, or one of the member of the couple is having diabetes. Okay, so by keeping that associated disease, we need to give the infertility treatment. So there is a statistics is very, very important. Now, the family planning initiative and policies, we know very well. Here in the big population area, the government already given the control. If you are having 2 children instead of having many children, you can get this many number of gift from the government. Like this, what they already introduced many number of projects, right? Okay, so in your exam, limited time to write the response, so you should be very fast in giving the exam. If they are asked, okay, here if it is 5 mark, if it is 3 mark, for the relevant question we need to give the diagram. Okay, if you're not giving the diagram, accordingly the mark will be reduced. So not only examples, not only the reason for the example, not only narration of the example, not only diagrammic illustration with the labeling, we need to give the introduction, everything in point by point in a systematic order for getting the maximum score.